Hi, I'm Rebecca Wood. I'm from Charlottesville, Virginia, and this is Charlie. I had to make impossible choices. Should I pay for her therapy or my exorbitant asthma medication copay? Choices like these aren't impossible, really. I choose to pay for hers and go without mine. One day, I needed an expensive dental procedure. Unfortunately, it was at the same time a therapy payment was due. Charlie's speech was emerging. I was afraid we would miss a window of opportunity in her development if we cut therapy. I chose to pay her therapy payment and put off my dental procedure. The decision cost me dearly. Due to the delay, an infection spread throughout my mouth and jaw. I went to the emergency department because the swelling in my mouth obstructed my airway. After a course of IV antibiotics, I was discharged. The next day, I had all of my teeth pulled, the infection drained, and parts of my jaw scraped away in a 6-hour procedure under local anesthesia. I could not afford to have it done under general anesthesia. I cried the entire ride home afterwards. Stories like mine should not happen anywhere, but certainly not in our country. Our healthcare system is broken. It's time we look to single-payer healthcare as a way of ensuring that families aren't faced with impossible choices like mine.
Now, I fully recognize that legislation which deals with 1/6 of our economy and over $3 trillion is complex, and that nobody, including those of us who are up here now, have all the answers. Unlike the Republican leadership, which tried to pass massive and destructive health care legislation without one public hearing, our job now is to take this legislation to every state in the country and to hear what the people have to say. Unlike the Republican leadership, we want to hear from doctors and hospitals and patient advocates and ordinary citizens as to how we can make this bill even stronger and more effective. We want to hear from the American people as to the fairest ways that we can fund this program. But to my Republican colleagues, please don't lecture us on health care. In the last few months, you, the Republican Party, have shown the American people what you stand for when you voted for legislation that would throw up to 32 million Americans off of the health insurance they have, and at the same time give huge tax breaks to the rich and large corporations. You, the Republican Party, have no credibility on the issue of health care.
When I called for a not-for-profit public option during my first House race in 2006 in a 2-to-1 Republican district, it became very clear to me that this is not a partisan issue. Healthcare should be a right. It should not be a privilege once and for all. So I will be standing with Bernie, and I hope all of you, to make sure that every single American gets access to affordable, good quality health care with a single payer system in America. Thank you.
We are here today to take another step. We will not back down in our protection of the Affordable Care Act. We will defend it at every turn. But we will go further. We will go further, and we will say that in this country, everyone gets a right to basic health care. That's what Medicare for All is all about, and that's why we're here.
Taxpayers will benefit. You know, our friends in the private sector, they talk about all the time. If they're asking about, are they being efficient, are they being effective, they ask that question with 3 letters. What is the ROI, return on the investment? Well, the taxpayers of the United States deserve a better return on their investment. And when you look at this situation, what we know, the public health model tells us so well. You want to deal with an epidemic? smartest, most effective, and cheapest way to deal with it is prevention first. If we're dealing with it in terms of early intervention, and certainly if we're dealing with it in the emergency room, it's too late and it's too expensive. Let's give the taxpayers of the United States a better return on their investment, which means Medicare for all. And why? Because Medicare for all stands for the proposition that all Americans from the day of birth throughout their lives will have access to health care. It means understanding that the data tells us somebody with high blood pressure, if they are receiving consistent care, information about what they should be eating, testing and monitoring their blood pressure, we know if we reduce that population who have high blood pressure by just 5%, taxpayers will benefit by $25 billion over the next 5 years. Better return on the investment. Let's look at it in terms of the emergency room. If people resort to the only care they can get in an emergency room, as opposed to monitoring on a daily basis, on a regular basis with a physician that they know and trust, we're looking at, right now in the United States, $35.7 billion a year in unpaid emergency room bills. It's a better return on the investment for the American taxpayer, and that is why I'm proud to stand with my colleagues and friends and support Medicare for all. Thank you.
It is embarrassing to me. I love my northern neighbor, but it is embarrassing to me to have a Canadian stand here in the capital of the United States of America and talk about a system that takes care of their children better than we take care of our children, our most valuable natural resource. And we are leaving so many of our children in the insecurity, in the pain, and the agony of not having access to quality health care. And so I was getting a little competitive back here with some of the New Yorkers and the Californians. And so let me just end with the words of one of the patron saints of New Jersey, a man named Bruce Springsteen. He says it proudly. We are a nation that takes care of its own. I cannot sit when Australia or Canada or England takes care of every one of their children better than the United States of America.
You know, cancer doesn't choose red states or blue states. It doesn't pick people according to their party registration at the polls. It is an equal opportunity killer. Disease doesn't discriminate. And I want to single out two groups of people. Number one, the women of America. They have been denied health care for too long because of restrictions like the Hyde Amendment. Consider the Hyde Amendment history if we pass Medicare for all. And all those other restrictions on reproductive rights. And to our colleagues who talk a lot about the opioid epidemic, there are millions of Americans who will be awake tonight worrying about their spouses, their children, their loved ones, their friends, their coworkers who need and deserve treatment, and they won't get it now. They will under Medicare for all. They need it, they deserve it. Health care should be a right, not a luxury. Access to this basic right is as American as our flag. We are the greatest country in the history of the world. We owe it to ourselves and our children to make sure we have Medicare for all. Thank you.
Good job.